going on? It's Dr. Matt from Pinnacle Chiropractic, your local pediatric, prenatal, and family chiropractic office here in the Lakewood Ranch, Sarasota, Bradenton, Florida area. Today's video, we're going to talk all about vagus nerve disorders. So what is the one thing that every single doctor should be talking about, but yet very few pediatricians and family medical doctors don't even hardly know anything about? And that's really the vagus nerve, and how the vagus nerve dysfunction and disorders are serious contributors to all sorts of neurological challenges in kids today. So the science is very clear, and there's more and more research coming out every single year that are linking the vagus nerve disorders and dysfunction to all kinds of common neurological disorders we're seeing in kids, such as autism, ADHD, anxiety, sensory processing disorder, and especially seizures and epilepsy. So this video is for you parents out there that are still searching for answers to explain your child's neurological conditions, and you haven't yet gotten a full understanding of what's really going on from your pediatrician, your neurologist, or your traditional care providers that you're seeing. It's also for you, if you've done all sorts of research into the role of gut health in neurological disorders and know about the gut-brain connection or the brain-gut connection and the vagus nerve already, but you want to learn more about the vagus nerve. So in this video, we're going to talk all about vagus nerve disorders, how they link everything from autism, anxiety, ADHD, sensory challenges, seizures, dysautonomia, POTS, PANDAS, and more. So we've had a lot of cases like this in our office, of cases of seizures where a child is having multiple daily seizures to seeing them have little to no seizures, and they're starting to thrive. Same thing with anxiety, autism, ADHD, sensory processing disorder. We've seen many of these cases improve a lot of their symptoms related to these neurological conditions being under our care and influencing that vagus nerve. So we'll really dive into the science next of how our care can help with vagus nerve dysfunction and vagus nerve related disorders. So if there was just one thing we wish we could teach all of our parents, it's this: the connection between birth intervention and trauma and early exposure to toxins in kids and what are called vagus nerve disorders and dysfunction. The vagus nerve is by far and away the single most important nerve in the entire body, serving to control and regulate core developmental and health functions in kids, such as sleeping, eating, digestion, immune function, speech and communication, socialization, behavior, and emotional regulation. So when this one thing goes wrong and the vagus nerve isn't working the way it's supposed to be working, it can open the door for a lot of different neurological challenges, in particular what we call really the perfect storm challenges. So vagus nerve disorders and dysfunction, they're strongly linked to common neurological challenges in kids, such as autism, ADHD, sensory processing disorder, anxiety, epilepsy, or seizures, as well as two conditions that are dramatically on the rise in teenagers especially, which are POTS and PANDAS. So here's how the vagus nerve disorders and dysfunction are linked. So first, the vagus nerve is often injured or damaged via birth interventions, which a lot of times with birth interventions like forceps, vacuum extractions, and C-sections, it's damaging the vagus nerve because the vagus nerve lives in this upper neck area here, and a lot of those cause a lot of force or physical stress on that upper neck of a newborn baby. Second, the vagus nerve is very sensitive to early exposure to toxins, so things like antibiotics and overuse of other medications as well. And vagus nerve disorders and dysfunction, known as subluxation, they first show up as early warning signs or early indications in infants with symptoms like colic or constipation or even ear infections. And parents, they are often told, don't worry, they'll grow out of it. They'll grow out of those challenges, which might be true, but what we know is if that dysfunction, that underlying issue is still there, they're going to grow into other challenges as they're growing and developing. So from there, they progress into neurodevelopmental delays, motor challenges, maybe they're missed milestones, delayed in walking and talking, or frequent tantrums and meltdowns, or other emotional behavioral problems in toddlers in the preschool age. And finally, from there, the vagus nerve, when it's not working properly to calm, balance, and regulate that side of the nervous system, the grade school kids and the teenagers, they often end up with a sympathetic nervous system that's stuck in constant overdrive and fight or flight which contribute to challenges like hyperactivity, impulsiveness, not paying attention, behavior, anxiety, and more. So for many kids, if the vagus nerve disorder and dysfunction is there long enough and severe enough, it can even contribute to really challenging and complex cases such as seizures, epilepsy, POTS, and PANDAS, all of which are conditions that are deeply rooted in neurological dysfunction and very much need advanced neurologically focused care like we provide here at Pinnacle Chiropractic in our office. So thankfully, the function of the vagus nerve can be measured and assessed in just about 3 to 5 minutes in our office with an incredible piece of technology that's truly now on the forefront of all of healthcare. It's called HRV, or heart rate variability. So this exam will tell us in just minutes if your child is struggling with vagus nerve disorders and dysfunction, and if so, how severely that dysfunction really is. So once we have this incredible HRV, or heart rate variability scan, and our other neurological exams that look for vagus nerve dysfunction and disorders, we can then put together a very customized and personalized care plan for your child to address these challenges head on without drugs or surgery. With our care, especially with some of these complex neurological cases, it's not 1 or 2 adjustments that's going to fix them, that's going to make them better. It's going to take time and repetition. It's going to take a series of adjustments over the course of months to really correct that underlying issue and calm that brain and nervous system down. So we ask you to continue to follow us on our social media pages, ask any questions or leave a comment below, send us a direct message, share this with other parents or family members or even in Facebook groups who need to hear this, and then click to read the associated article or go to our website and read some of our other articles as well. So with our office, we're big on education. We're going to continue to pump out content through video format like this one, through written format, and our blog articles. You can visit our website, pinnaclebradenton.com. Click on our blog. You'll see many different articles that we've written and put up on various different conditions and how they relate to the brain and the nervous system, which is our focus in our care. So hope you guys really enjoyed this video, and if you did, like I said, like, comment, and share this with any friends or family members that you know that might need this. And as always, guys, I'm Dr. Matt, and we'll continue pumping out content, and we will see you guys on the next video.